federal government has officially launched the National Strategic Plan of Action on Cholera Control, NSPACC, a comprehensive operational plan developed through a multi-sectoral approach to eliminate cholera as a public threat. The historic launch held in Abuja was organized by the Nigeria Center for Disease Control and Prevention, NCDC, in collaboration with the Federal Ministries of Environment, Water Resources and Sanitation, Health and Social Welfare, and the Global Task Force on Cholera Control, GTFCC, and it's Ending Cholera, a global roadmap to 2030, which aims to reduce global cholera death by 90% and eliminate the disease in at least 20 countries, including Nigeria. These are all with a view to ensuring that Nigeria meets global water, sanitation and hygiene WASH standards, which are crucial to cholera prevention and control. Action Plan on Cholera will form the crux of our conversation on Nigeria Today. Thanks for joining us. I'm Eukaria Clinton. With me in the studio for the conversation is Dr. Isaac Eboja. He's a public health specialist. You're welcome to Nigeria Today.
Good evening.
It's always a pleasure to have you,
My pleasure to be here.
Also with us in the studio is Chukwuemeka Ogwano. He's a senior partnership manager, Nigeria Health Watch. It's a pleasure to have you on Nigeria Today.
Yeah, thank you very much for having me.
I'll start with you, Chukwuemeka. We know you are, one of the partners, for this launch of the action plan on cholera. So tell us about this strategic plan of action on cholera recently launched, and what are the key components?
Okay, thank you very much. Maybe just to start by saying that there's the Global Task Force for Cholera Control is a global body that sets a strategic direction to tackle cholera globally with an ambitious target to end cholera by 2030. Nigeria's strategic plan of action for cholera control that was launched yesterday was launched by three ministries: the Ministry of Health, Ministry of Water Resources, and of course the Ministry of Environment as well. Came together to really add the driving force to set Nigeria's strategic direction and roadmap to end cholera. 9 strategic pillars are captured in the plan to really mobilize multi-sectoral stakeholders across disciplines. This ranges from the surveillance pillar, case management pillar, risk communications pillar, oral cholera vaccine pillar. So there are various pillars with various line of actions, to really ensure that cholera is timely detected and treated. But the very key thing, of course, that we should know about cholera is that prevention is key. Cholera is not a disease we should be having, especially at this time, in the country. But it's also very timely that this plan has been launched, because what you see previously is that cholera action to manage cholera cases is often reactive, when during the rainy season, when cases tend to rise. But it's important to have these conversations early on, early in the year, in anticipation of this increase in cholera cases that we know usually happens during the with increase in rain. So it's important to mobilize this conversation, mobilize stakeholders and have these conversations now to really understand what our strategy is, and of course the plan that was launched sets the framework for that.
Thank you very much for that opening remark. Now, Doc, of course, just like Chukwuemeka mentioned, the rains are coming, and of course, during the rainy seasons when we have, some kind of diseases that really, are prevalent. Now, what is your take on the commitment of Nigeria in the fight against cholera?
Well, first of all, let me make an introduction of the disease. Cholera is a waterborne disease. It's preventable. And like he just mentioned, actually we shouldn't be having cases of cholera the way we have it now. Generally, if you have safe water, when I mean safe water, I mean treated water, your environment is clean, you keep yourself clean, you shouldn't have cholera. We have cholera because of death. We have cholera because of contaminated water. We have cholera because most of the sources of water we drink are not good sources. When I say they are not good, because they are not treated water. They are not sources of water that are treated. What do I mean by treated water? Water that is treated by chemicals or by boiling or by filtering or the combination of all that I have mentioned. Okay. Now, generally, if your environment is dirty, like I mentioned, and you defecate openly, like we do in our environment, unfortunately, and the rains come, water will carry the feces. The sources of water that we drink or use will be contaminated, as it normally happens, especially with the first rains. Therefore, one of the things to look out for is to make sure that we don't defecate openly. We keep our environments clean. We keep ourselves clean. When I say keep ourselves clean, I mean we wash our hands as frequently as possible. We wash the food that we eat. We cook the food that we eat very well, those that need to be cooked. There are certain food items that we don't cook, like salads and so on, and so, fruits and so on. Those should be washed properly, so that even if there is cholera bacteria in them, they will be washed away.
Okay. Now you talked about washing the foods we don't cook. Is using salt to wash them?
Yeah,
can it help?
That's fine. Very well. Very well. Normally, salt can be used to wash a lot of things, especially fruits, vegetables. If you put water and you add salt to it and use it to wash, and make sure you rinse them after you use the salt. Otherwise, you're going to consume more salt than you need to.
Okay.
That's important. And one of the ways of doing it is to make sure that whatever you are washing, you hold it, somebody pours water, or there's a source of water above your hands, and the water drains down. Okay. So that if it is fruits or vegetables or so on, they are not part of the contaminated water that is already washed. Because sometimes some people put water in a bowl, put fruits in them or vegetable in them, and wash them.
Oh.
And then take them out.
Oh.
Well, you are just washing into the bowl, and you are taking the fruits out of the bowl, still contaminated.
Okay, that's not the right way of washing your vegetables.
No, you should hold it and wash it down, wash it away.
Okay.
And the water that has already touched the vegetable or the fruit should no longer remain on the fruit or on the vegetable when you consume it. That way you are sure that the bacteria that might be on it is already washed off.
Okay, now back to you, Chukwuemeka. How significant is the collaboration between, non-governmental organizations like yours and government agencies in the fight against cholera?
Oh, great. So, in speaking about the collaboration and the significance, perhaps start from saying that rather driving the response to control and eliminate cholera and also prevent cholera is being led by the Nigeria Center for Disease Control and Prevention. They are the National Public Health Institutes with this responsibility, because cholera is an endemic disease that often leads to outbreaks, right? Endemic is basically means that it's always with us, like malaria, right? But of course we know that it shouldn't be. We also know that the government cannot do this alone. Everybody, I like to say that everybody has a role to play, and that's why if you look at all the communications by the government on cholera and issues like this, they always use the term multi-sectoral approach. So it's a response that cuts across various sectors, right? Both the health sector, where you have the Ministry of Health and the Nigeria Center for Disease Control involved, and you have the water resources. This is a different sector that is involved, and of course Ministry of Environment, right? So we all play a collective role. What the often neglected bit beyond even non-governmental organizations is the general public. And from all my colleague here has said, what I like about cholera basically is that it's something that we all have a responsibility for, and we all have the capacity to prevent, right? By simply, washing your hands and washing your food items, especially those ones that would not pass through heat, just like he mentioned. Non-governmental organizations or civil society organizations like mine, Nigeria Health Watch, is at the forefront of driving the advocacy, right, to ensure that government prioritizes diseases like cholera for elimination and for prevention, right? We shouldn't wait till you have heavy rains and flooding and high numbers of cholera cases before we start to take responsibility. It's also important to remind people, like we would do. Our main advocacy is that, see, it's not a situation that lies within the health sector, right? It's mainly when you preventing cholera is through provision of access to clean water. So you see that a huge bit of this responsibility also lies with even local governments, right, that provides these facilities, right, access to water, sanitary facilities and infrastructure. People shouldn't be defecating openly, right? You should have access to sanitary facilities, whether it's in the schools or communities where people can go to and use these facilities, so that when you have some flood incidences in some parts of the country with poor drainage, the water that people drink from don't mix with feces, right, where this bacteria that causes cholera is contained. Because when that happens, when you have rising water and flooded drainages and all of that, they get contaminated. They contaminate drinking sources, and when people drink this water, they get infected, right? So on the prevention end, organizations like us try to raise awareness. Nigeria Health Watch has various platforms where we try to drive awareness on cholera prevention, but also to hold the government accountable to deliver.
I'll have to stop you here, Chukwemeka. Later I will ask you, I would want to know what your organization is doing, to combat the menace. But before then, we'll take a breather here, and the conversation will continue after the break. Don't go away.
The implementation of the ruling is also dependent on another aspect or another arm of government.
Nowhere in the world will allow under digital economy for banks not to be dispensing domestic currency in that economy.
What will make this one different? We want to know what they do as occupation. All of these are attributes that our questions have been designed to investigate.
In a few days to come, you see that we are all around their own crannies and everywhere in Nigeria, telling people to cooperate.
Welcome to Nigeria Today. Welcome back. This is still Nigeria Today, and we're looking at action plan on cholera. And of course, I have with me in the studio two gentlemen to address, to talk about some of these issues. And actually, Doc, of course, earlier on when Chukwemeka was talking, he said we shouldn't be talking about cholera as a country. It's something we can prevent. What are some of the challenges you've noticed that we have in trying to combat these diseases?
Well, one of the major challenges that we have is the lack of safe water. Most people in the country still don't have running water, safe water, treated water. When you tell people to boil water, for example, in the village, they don't like it because boiled water doesn't taste too well. And plus, the process of boiling water, cooling it, keeping it before you drink it is a little bit cumbersome. So most people don't like it. And then the sources of water that people use, most Nigerians use, are from the streams, from the wells, from the boreholes, and stagnant water in particular. And this is one of the problems that we are worried about. You could say that when the rains come, the possibility of cholera is higher. That's true. But also at this time of the year when water is stagnant, sources of water, stagnant sources, if any source is contaminated, then everybody that takes water from that source is at risk of getting diarrhea. Now, we've talked about personal hygiene, we've talked about environmental hygiene, we've talked about cooking food or washing them, but we should also be talking about the connection that we have between what he just talked about, the action plan, and the Sustainable Development Goals, which one of the goals is that there should be provision of sanitation, safe water, environmental hygiene, personal hygiene by 2030. Everybody should have access to all those. The problem we have, one of the challenges we have is what I just enumerated, that in our country, so far, we do not have enough sources of water. We still have problem with our sanitation. A lot of people still don't have toilets, and people defecate openly in many places. It is improving now. It's better than it used to be, but we still have that as a problem. And as a people, we're not too comfortable with washing hands when we don't think that our hands are contaminated. I say when we don't think, because at all times our hands are contaminated, at all times. But we think that it is only when you rub your hands on something dirty or you soil your hands that it is dirty. No, that's not true. Your hands are dirty at all times. There's a possibility of bacteria in your hands. So the more frequently we wash our hands, the better. One. Two, the more frequently we wash the foods that we eat, the better. And the more we boil those that need to be boiled and boil them properly. Not only that, after you boil, make sure you serve it in a clean plate.
That is washed. Too.
That is already washed.
Properly washed.
Yes. That's very important. And if for any reason, I should say this, if for any reason somebody comes down with diarrhea, the case of cholera is very different. The diarrhea is profuse, it is relentless, meaning it is continuous, and the diarrhea is very watery. There's always vomiting that is associated with it also. Sometimes there is fever, and sometimes there is no fever. When somebody has diarrhea, we should pay attention and make sure that whoever is looking after the person also looks after himself or herself. The person's hands must be washed, clothes must be washed, the patient's clothes must be washed and changed, and whoever has diarrhea should be reported to the nearest health facility. Before that, one of the things that kill patients due to diarrhea and vomiting is dehydration. So it is important for the patient to be rehydrated. What do I mean by rehydration? Rehydration means you drink plenty of water. People have asked questions. Okay, you say water should be purified or boiled and cooled before one drinks. How about if somebody comes down with severe acute diarrhea and we don't have that kind of water? Should we give the person any water that we find? Yes, you should. Not because it is recommended, but it will prevent dehydration, which will kill the patient before the bacteria itself.
But what will you do to the water since it's not boiled?
You filter it.
Is there anything you add to the water?
Yes, you can add chlorine to the water. But I want to caution because
what of salt and sugar? I've heard about that.
Okay, that's different.
Okay.
That is oral rehydration solution.
Okay.
Oral rehydration solution can be prepared by taking a liter, that big cup of water, adding about 6 to 7 spoons, teaspoon, not tablespoon, the small spoon of sugar, and 1 of salt, and then mixing it very well. And then the patient can drink as much as he or she can take.
Okay.
After 24 hours, you will discard that oral rehydration that you prepared, and then solution that you prepared, and you have to pick a new one. So don't keep it more than for more than 24 hours.
Okay, I will have to stop you there, Dr. Isaac. Now, Chukwuemeka, earlier on you talked about action. Of course, we're talking about an action plan, but of course, there's been a lot of plans in other areas. But then we're talking about actionable response. What area do you think, the government should do more to ensure that we meet the target? Because we've said by 2030, cholera should have been eradicated. What areas do you think government should do more to ensure that we achieve this target?
Okay, very, very important. So managing or controlling a disease like cholera has the preventive aspect and the reactive aspect. So first of all, you want to ensure that you're preventing the disease, you're doing as much as you can to prevent the disease. Then when it does happen, you now want to ensure that you are able to respond as quickly as possible to meet. There's a target there of, I think, about 90% to reduce the case fatality rate by 90%, right? So it's very important that all stakeholders who have a role to play, especially the government agencies, understand and are also aligned with this roadmap, with this national plan. And also have the capacity, understand their role and capacity to respond as needed, right? What we often see is that the health sector is left to bear the brunt of the responsibility of tackling cholera. Meanwhile, the health sector, you mostly, the most of your responsibility is the reactive bit, which is when people do come down with cholera, right? You now manage the cases, just like he was mentioning about the oral cholera vaccine, right? So the NCDC has a national surveillance system, or a surveillance framework, where across the 36 states, they have systems to immediately detect a case. So if there's a cholera case reported in any community in Nigeria, they already have, they already know how to report these cases to the nearest, to the health facilities. The health facilities and the disease surveillance officers at, every community in Nigeria understands how to report, how to even detect and know whatever case, what the cholera case looks like, what symptoms they should look out for, right? And to ensure that it is reported and managed in a timely way, because like he said, the dehydration is one of the key reasons or factors that lead to death when somebody has cholera. So you want to ensure that you reduce the time between when a case is detected and when they are managed, right? But importantly, we always emphasize on prevention, and that's really where organizations like Nigeria Health Watch play a role, really, to bring these issues to the government's attention, right, at all levels, both the national, federal government and the state government, and also the local government. So good, we have the ALGON that gives more autonomy to local government. So we want to see more a higher sense of responsibility by this by the government across all levels, to ensure that they provide the necessary infrastructure, that people have access to clean water, people have access to sanitation facilities. But also, you want situations where in schools as well, right, every jurisdiction, people have access to clean water. So in schools, for instance, a lot of people don't know that you have something called the school health program. That if it's active, right, it ensures that every school has a clinic that can manage a case, that have wash facilities. WASH stands for water, sanitation and hygiene, to ensure that these are prioritized, right? One of the key pillars in the framework is it's called the case management and infection prevention and control pillar. This ensures that people are able to take necessary measures to prevent the disease, to the clean hands. He mentioned washing your hands either through soap and running water, or through using a hand sanitizer if you don't have access to clean water, to ensure that prevention is done. And the key thing here is that if cholera cases, if we focus as much as possible on prevention and get the prevention right, you have very little people to manage.
Of course, if we are able to prevent it, we have, in fact, we'll end it. We'll end the disease. Now, Dr. Isaac, now, he said something very, very important, Now, in 30 seconds, tell us, what role can we all play? The community leaders, the public, what is our role in all of this?
Our role is to participate in the WASH that he talks about. provision of safe water, environmental sanitation, personal hygiene, very important, making sure that we all have toilets and we use them. Some people don't, do you know, in the villages, some people don't like to use toilets. We need to use them. And we need to do everything that we can to have safe water, clean environment, clean bodies, clean food, and of course, clean source of water. And that's it.
Thank you very much. Thank you very much. Dr. Isaac Ebuoja is a public health specialist. Thank you so much for your time and your contribution. And also we had Chukwuemeka Ogwanwa. He's a Senior Partnership Manager, Nigeria Health Watch. Thank you so much for your time.
Thank you, Ikeria.
And thank you for being part of the program. I'm Ikeria Clinton. Goodbye.